Hi, everyone. I'm Sandra Arevalo, and I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital. And I'll be your host of this community chats that it's called HIV Ending the Epidemic. So today we have two experts with us. One is Carlos Roman. He's from our Jacobs Family Pride Wellness Center. And he's going to be telling us a little bit about what we do at the Jacobs Wellness Center. And then we also have Justin Toro, who is from the Oval Center in New York City, in the Bronx, actually. It's New York, but it's not New York City, it's the Bronx. And Justin, that's amazing work over there. And as a matter of fact, I have to say, he's also been a terrific support, right hand, and anything good that you can think of for our Pride Center here in Rockland. So I'm gonna let them introduce themselves and also tell us a little bit about the Oval Center and the Pride Center. And maybe we start with you, Justin, because you know the Oval Center is kind of the parent to the Pride Center here in Rockland. So maybe you wanna tell us about that program, and then Carlos can tell us about Rockland Pride.
Absolutely. Thank you, Sandra. So good afternoon, everyone. As I like to say, happy Friday Eve. We're almost there. So as Sandra mentioned, my name is Justin Toro. I use he, him, and L pronouns. I'm the Associate Director for LGBTQ Services and Sexual Health here at Montefiore Medical Center in the Bronx. I have the humble pleasure of being able to oversee our Oval Center. So our Oval Center is the sexual health clinic for Montefiore Medical Center here in the Bronx. We provide an array of services for individuals 16 and up, including generalized sexual health screenings such as STI screenings, treatment, and diagnosis. We do HIV primary care for individuals living with HIV. We do HIV prevention care, which is very big in regards to PrEP, PEP. And then we have a very large trans wellness program that we do a lot of hormone and gender affirming care for individuals that are coming to see us. We are a pathway for surgeries here at Montefiore Medical Center, so we do own our trans wellness program for the institution for the health system. And that's really just kind of a way for an individual that is looking for engagement into gender affirming care, pathways for surgeries, consultations, mental health support for individuals. So we're really trying to centralize what we're doing for trans identified and gender nonconforming individuals. So this way they don't feel so lost in the medical system, because we know with hospital institutions and medical systems, they are huge and a lot of people can get discouraged. So we always want to make sure we're providing support for individuals that may be naive to the medical system or just feel like it's very overwhelming. So we want to make sure that we're providing support and some hand-holding, just this way we can get folks introduced to the system, get them connected to the right places, and make sure that they are having safe spaces. So we definitely had the opportunity to work with Montefiore Nyack Hospital, with Rockland Pride Center, to create our baby, the the Jacobs Family Pride Wellness Center at Montefiore Nyack, which we just celebrated our 2-year anniversary in November. Very excited that we've been open for 2 years already.
We're a toddler now.
Yeah, we're a toddler. Oh, the terrible twos, the terrible twos. So I'll actually let Carlos kind of talk a little bit about about our Jacobs Family Pride Wellness Center.
So I think Justin pretty much gave a great introduction to both the Oval Center as well as the Jacobs Family Pride Wellness Center. I'll give some more information about that. So my name is Carlos Roman. My pronouns are he, him, L, and I'm here as the health educator representing the Jacobs Family Pride Wellness Center at Montefiore Nyack Hospital. So again, as Justin said, this was a collaboration between Montefiore Nyack Hospital, the Rockland County Pride Center, and Montefiore Medical Center on behalf of the Oval Center to really create that type of care here in Rockland County. We know that this care has been available. LGBTQ plus and gender affirming healthcare has been available in the city, but that's not necessarily accessible or reachable for people who live in the Hudson Valley in northern New Jersey. So really the idea was birthed to say, okay, we have this gap in care, so let's create a space here in the Hudson Valley. And gratefully, it happened here at Montefiore Nyack Hospital. So I'm super grateful. I'm the health educator there, helping with some of the navigational support of like the insurance things and all that overwhelming, burdensome stuff that has to deal with healthcare. But we provide a lot of the care that, again, as Justin said, the Oval Center provides: sexual health care. We provide STI screenings, HIV treatment, HIV care, HIV prevention, as well as gender affirming healthcare, including hormone replacement therapy. So we are really providing the type of affirming care that hopefully, ideally, would be the type of care that we would see replicated at every clinic at every medical institution. So we're very grateful to be partnering with Montefiore Medical Center, and of course having Montefiore Nyack Hospital leading the way here in the Hudson Valley has been just really a great pleasure. And it's the care that's been needed. And we are a growing clinic. We started with just 2 days of clinic sessions. We are now up to 3 plus 4 days if you include nursing visits, and we are growing, and we are actively talking about growing because the need is there. And of course, with a patient base that's growing, we want to make sure that we are serving the community as a whole.
Yeah, and hopefully very soon full time, right? And there might be people that are wondering, well, why do we need to have clinics that are specialized in LGBTQ care? And I think that it's important to discuss that, and maybe we can start this discussion there, because I know there is a lot of discrimination and inequity. So, but you're the experts, you're in the field, and you're the ones, who know all these specific cases. So why don't we talk about that? Maybe Carlos, you want to continue?
Absolutely. So, to just sort of give a background as to why I entered this type of work is because as a gay man, I know the stigma, the discrimination, and the history around being part of the LGBTQ plus community. I think we're having a conversation today about HIV. And I think probably the most emblematic example in which health was disregarded for a population that was seen as not important enough to receive care was during the emergence of HIV during the 1980s. We saw that the government did not take interest, did not invest in it. It really caused for a lot of people during the start of the epidemic to lose their lives because there was just not investment and there wasn't buy-in that this was an actual public health crisis that was worthy of getting the type of care and commitment from government and other agencies. So coming from that perspective, we continue to see that there are these inequities. We continue to see that there are shortfalls that exist when it comes to healthcare for the LGBTQ plus community. I could talk about the politics of what's happening right now across a lot of this country, in which gender affirming healthcare is being used as a political cudgel. So the reason why we need this type of care and the reason why it has to be specialized and specific to our community is because we have the history to prove that we were not considered worthy of the type of care that we deserve. And so because of that, we have to create this type of care in these spaces where we can ensure that we have providers, doctors, nurses, and staff that are of the community or that are allies of the community to make sure that the delivery of care and that the follow-through of care is actually there. Because unfortunately, we see astounding disparities when it comes to healthcare outcomes, when it comes to our community. And that is not necessarily on the patient, that is on the fact that we have a system that has not been affirming. And so creating this space where we have affirming healthcare has been essential. So again, the Oval Center and the Jacobs Family Pride Wellness Center, we exist as spaces that can ensure that people get the type of care that they need and that we are committed, that they remain engaged in care. And then if there are social determinants of health or other factors that are causing them to fall out of care, that we're addressing those things in a way that unfortunately the healthcare system has not been adequately doing in the past.
And I feel that it's very important to feel that you have a good relationship with your healthcare providers and that you can be very open and that you can talk about anything. And, we lack a lot of that, unfortunately. And I don't think that, our system is at that level where we can actually go to the doctors or even nurses, whomever it is in healthcare, and talk about all of our issues without facing some sort of discrimination. Justin, would you like to add something?
Yeah, so particularly for trans-identified individuals, unfortunately, I am not a trans-identified individual, but working with the population for some time, we hear a lot of feedback of kind of the experiences that they have when going to the providers or going to kind of non-specialized providers or non-understanding providers or not open providers. Misgendering, dead naming. So in regards to dead naming, that's when someone uses someone's legal name that may not be changed yet instead of a preferred name. So, things like that, unfortunately, can be really triggering for folks. As for trans-identified individuals, the minute they step out of their homes, that's probably, if not the only safe space that they have, because unfortunately we know Homes are not always the most safe space for people either. But again, trans-identified individuals are leaving spaces that are safe. And also, I mean, I kind of teeter with the word safe space because at the end of the day, is there really a fully safe space for anybody in the world we're living in right now? So I'd rather use the word safer space. So in regards to this idea of safer space, just making sure that when a trans-identified person leaves their home or their safer space, they're they're facing discrimination at the grocery store, at school, at work, with family. There is every turn a trans-identified individual is faced with discrimination, with stigma, with violence. Unfortunately, we see a large number, particularly of our Black trans feminine identified individuals losing their lives due to violence. So, at what point do we say enough is enough? And when do we start protecting our trans brothers and sisters? So for us, I think this is why we wanted to create the Pride Wellness Center, is to be a safer space for individuals, but also be a safer space for Rockland County, Nyack County, just outside of the city and outside of the Bronx. Because to be honest, someone shouldn't have to travel miles upon miles to get good quality care. We should have these centers close by for anyone because it's not like the need's not there. There are so many identified individuals. I think most recent data tells us there's probably about 9.5 million identified LGBT folks in America, and that number is growing. So if we have one small center to serve a number of counties, that's a problem. So the more visible or the more availability that we have for folks, and granted, maybe we're saving them a trip from the bridge, maybe we're saving them a toll because we have this new center that's right on that side of the bridge. But again, we really should make sure that these places are visible for folks. So it's not like feeling back in the day where we were kind of like underground looking for things, having to use code names like, are you a friend of Dorothy, and things like that. We should be past all of these things, but unfortunately not. And as Carlos mentioned, it's a top-down approach. And unfortunately, those that are in power above us trickle down a lot of the things. There's over 400 pieces of legislation right now currently sitting that are attacking LGBTQ folks in the US. That is a huge amount of that's 1+ each day of the year that our government or Congress is trying to attack LGBTQ identified individuals. Granted, we had gender that was passed. Granted, we have, the ability to put X on a driver's license. These are little successes, but again, we are consistently fighting every day for basic equality. And for us, we really wanted to make sure that, we provided this safer space for folks because we realize that it's not everywhere. So when we have somebody that comes in to see us the first time, we want to make sure that they have an excellent experience, because we know if somebody goes to a provider's office and they do not have a good experience, they're not going to return.
No.
Or they might be completely turned off to medical care, that they might, decline to go get care because of the experiences that, and we know those can have really bad health outcomes. So the best experience we can provide to folks definitely is our goal.
So, going back to our topic of the HIV epidemic, past, present, and future. Carlos just mentioned, it was during the 80s where we had the worst HIV epidemic and very little was done. Do you think it had to do also with discrimination and the fact that the people that suffered the most with HIV were like gay men?
Yeah, I mean, it wasn't until President Reagan's wife had said AIDS or said something like that that was finally acknowledged. So, it was such a taboo thing because it was deemed as a gay man's disease. And we already know with homophobia, biphobia, transphobia, social justice issues that come into play here, until it affects, and we've heard the saying before, until it affects home, people don't really care. So now the fact that this was affecting people close to home, friends, family members, sons, uncles, fathers, et cetera, that were expiring from this disease or complications from this disease, I think that's what really started getting folks involved and interested, is because it started affecting them close to home. And they started recognizing, like, this can be my gay son or this can be my gay brother that could be facing this. So then how do we become allies and try to fight the system as best as we possibly can?
Or we might not, or it might not be gay, right? And I think that that's the issue as well. Like back in the 80s, I mean, first of all, it was such a stigma to have HIV. So if you put things together, it's like the discrimination against LGBTQ people. And, you know, even if you're feeling sick, you're not going to seek the help that you need because you know that you're going to face all discrimination and hate. But then heterosexual men and women also can get HIV, and maybe they are not dying in high numbers. Why? Because they do get the care that they need. So that's something that we also need to think about in how, you know, that those disparities between, you know, so sexual orientation, gender identity are also playing a big role in the way we're treating disease, because, you know, people don't feel comfortable actually seeking treatments.
Absolutely.
Has that changed at all nowadays? Do you feel that it's getting any better, worse, the same?
You know, it's a very complex question. I think because comparing today to the 1980s, we're belong to the LGBT plus community, of course. We're seeing certain segments of our community, as Justin had mentioned before, being particularly targeted. So, in particular for our trans-identified folks, the discrimination is very active. It's very real. Again, not just in healthcare, but just in general. We hear the narratives, the political narratives, and we know that that leads to legislation and it leads to so many other things. So I think that the maybe perhaps the specifics have changed over time, but unfortunately, we're still dealing with this level of discrimination that's targeting our community. It just is manifesting in different ways, and it's showing a different form. And it's showing a way in which you can sort of get more popular buy-in, just like it was done in the 1980s when it came to the HIV epidemic. So I would say I would never want to be the Debbie Downer here and say that things are terrible, horrible, but I also can't be like Pollyannish and say that things are great, because they're not. The reality is that we still are fighting for basic rights for our community. And as it relates to even HIV care, which again is something that you would think that we would have made such enormous progress. And even if it's anecdotal or if it's just you're teasing out the data, it's still showing these inequities exist. And these inequities exist because there isn't sufficient buy-in by the vested interests and the stakeholders that really need to actually take charge in this. So I would say I'm always going to be optimistic, but I'm always going to have a much larger dose of realism into it. And because the reality is that we as a community are still facing discrimination, and it's happening. It is happening on a constant basis across all 50 states. And I want to emphasize that even though in New York State, we may seem like a safe state for our community, this is something that is very much alive and is definitely being nurtured in this state to undermine and reduce equities, equality, civil rights. These are things that are actively being done here in New York State. So I know that we often point to Florida and Texas and all these other states, but we have to make sure that we are very aware of what challenges against our rights are happening here at home in New York State.
Justin, go ahead.
You know, and I was going to mention, even though, we are New York as a whole, city and state, New York City, while we claim to be inclusive and things like that, there's still work to be done. And there's very certain parts of New York State that are not safe for individuals. And it's crazy to think that just within a few hundred miles, we're all in the same state, and one would think like, oh, this should be a thing. But that's very indicative of any other state. When we look at, voting and things like that, when we see those little pockets of blue in a very large red state, we wonder, hey, where do these folks go if they need to leave this small, safer, hotspot where all the blue people are? Where do they go outside of there? The idea of abortion rights, things like that. I was at a meeting yesterday, and the question came up, what have we been doing for women? And I very proudly said, we have failed women for many and many years when it's come to HIV prevention, when it's come to HIV
Right.
treatment, when it's come to things like that. Because while the focus was on MSM, gay men, trans identified females, at the end of the day, everyone's at risk for anything if they are sexually active. So what are we doing to better, put out a message that regardless of one's sexual orientation, gender identity, race, creed, etc., if you're engaging in any unprotected sexual activity, these are the possible repercussions that could happen. But here's the way we can prevent, here's the way we can treat. It's very simple information, but unfortunately, because it's a taboo subject such as sexual health, providers don't feel comfortable. We're seeing kind of this kind of gap between old school providers or seasoned providers, as I'd say, versus kind of our newer school providers. There's much more emphasis now in medical training around sexual risk behavior taking, around preventative medications, around just general social medicine, and looking at a whole person. Right now, it's a very big key term, social determinants of health, looking at a person's home situation, family situation, employment, education, childcare. We can't just have someone sit in front of us when we're completing a visit and just say, this is strictly medical. Because 9 times out of 10, medical is the last thing on somebody's mind. Everything else, they can't keep a job, they can't have a house. How can we prescribe a medication for somebody to take with food if they don't have access to food? It's these little nuances that we really have to really care about for a whole person to be successful in their care. So it's step one, creating the safer space. Step two is making sure that the infrastructure is in place, that if somebody comes to us and says, hey, I have A, B, and C going on, okay, we're going to take care of A, B, and C. We're not going to say, we can only do C, we're going to send you somewhere else to A and B. We can't do that anymore because one, people get lost in that transition and that referral, but also two, can I confidently say that when I refer a patient somewhere that they're going to have a good experience or it's going to be a safer space? We don't know. And I would never want to put somebody at risk for stigma, for discrimination, because I sent them somewhere. So, again, it's really making sure that these small steps are being taken to provide really good care for people.
And Justin, you said something very, very interesting here. You said if you're sexually active, you're at risk. Everyone is at risk. So let's talk about risk a little bit more so that, people learn about this risk.
Yeah.
Go ahead.
So in regards to, sexual health as a whole, the one thing I think we can all agree on is most likely everyone on this call didn't receive really good sexual health care education in school.
Yeah,
That,
if at all, if at all.
if at all, if at all, if at all. And if we did receive sex ed growing up, it was done by a math teacher who maybe didn't understand all the understandings that needed to go in. It was very kind of policed, is not really policed, but it was censored, the type of education that could be
And
given.
definitely religious.
There's very, religious context that go into that as well. So, if we're not having open, honest conversations about the type of sex that people have, we're actually having really big missed opportunities. When we do triage for folks, when we're doing vitaling for folks, we make the very clear indication that regardless of who's sitting in front of us, we're asking, where do you engage in sexual activity? Because if you engage in sexual activity in an orifice, we want to swab it. We want to make sure that there's no risk or there's no danger or there's no infection there. A lot of people feel uncomfortable to say that they're engaging in anal sex. Male or female, trans or not, or cis, folks have this discomfort when it comes to talking about anal sex. So when we start having these conversations every single time with people, we start normalizing the conversations. So we tell folks if your tongue, if an orif, if a, I don't know if I can say these words on Zoom, but if genitals can be, if anything's going anywhere, we need to swab it. We need to understand and we need to know what's going on because, you may telling us signs and symptoms. We're doing urine, we're doing blood, we're swabbing your throat. Everything's coming back negative, but did you tell us you had something going on in the rectum? So again, it's these little missed opportunities, but really it's understanding that also we shouldn't really be, how do I want to say this? When we're seeing a new patient, 5 minutes into the visit, I'm not going to be grilling you on who your sexual partner's on. I want to know about you. I want to know what's going on in your life. And then as we get comfortable in the conversations, then we can start easing into the sexual health conversation. Because if I'm a new patient and I'm sitting in front of somebody and 2 seconds into the visit, they were like, oh, are you having anal sex? Whoa. Like, hold on. Let's talk about some other things first before we get there.
And you don't
But
need to be gay to do that.
not at all. Not at all.
No.
Because again, we are seeing more women that are engaging in anal play. And that's a wonderful thing, whether it's with a penis or whether it's toys and things like that. It's a wonderful thing for people. People deserve pleasure. Point blank, period. People deserve pleasure, whether it's with themselves, with one partner, with 7 partners, whatever your prerogative is, that's wonderful. And we implore that and we applaud you for that. But we want you to focus on your health, because then you have to take care of yourself, and then your partners have to be taken care of as well. But again, we use the airplane reference. Put your mask on before somebody else's. You have to take care of you first, and then we can worry about your your sexual networks and making sure that they're taken care of. So again, it's just revisiting these conversations every single time until we normalize these conversations. They're going to continue to be taboo.
So, Justin, if I'm hearing correctly, it doesn't matter who you have sex with, how many people you have sex with, as long as you're safe, you take precautions, and you make sure you're healthy, and obviously, make everybody healthy too around you, because you kind of spread that disease. So, what measures do you suggest people take to be safe?
Screening whenever possible, whether it's a new partner, whether it's every month, whether it's every 2 weeks, whether it's every 3 months. Testing is really the only way that we can accurately know what's going on for folks. And particularly repeat screenings. When someone's diagnosed with HIV, usually the first question they ask is like, well, when did I get it? How did I, the question of how kind of doesn't really come up. Some folks really know about that, but it's the when did I get it? So for us, we usually say if someone is coming in and getting tested habitually every 3 months, it's January. Let's say somebody came to see us in October, HIV test was negative. They came to us in January, HIV test was positive. We can confidently say, hey, within the last 3 months, unfortunately, someone may have infected you. So, just having that reassurance to know that, we can kind of track down or monitor kind of longevity care for someone. But also in regards to, whether it is PrEP, whether it's injectable PrEP, whether it's oral PrEP, whether it's using condoms, whether it's Doxy for PEP. And Doxy for PEP is a little bit more of a new idea, where for prevention of syphilis and kind of chlamydia, we're kind of learning, but mainly for syphilis, folks can take doxycycline 24 hours after an exposure to prevent unwanted syphilis or chlamydia. We now have preventative measures for HIV. We're looking at preventative measures for syphilis and chlamydia. There's a vaccine study for gonorrhea right now. We are hoping that we can create this prevention toolkit for folks to say, be your happy sexual health that you want to be, engage in as much sex as you want, but understand that there's a responsibility to stay safe for yourself. So understanding if you're going to go enjoy a number of sexual partners this weekend, have you been taking your PrEP every day? Do you have Doxy on hand, so this way you can take it after maybe this little bit of a more partying weekend and things like that? And then there's a whole nother conversations of substances that get into play, but that can be a whole nother webinar by itself.
So it's interesting, I'm thinking, you're making me think of, when you're an adolescent and you're gonna start having sex or something, it's like prevent pregnancy.
That's
It's
it.
like the same thing. It's like, okay, you're gonna be sexually active, you don't want to get pregnant, so here, these are your tools,
Correct.
It's the same way. It's like, okay, whatever the heck you're gonna do, but as long as you keep safe,
Yep.
and you keep your community safe, and you keep yourself safe, your family safe, everyone. So that sounds good. Now tell us a little bit more about PrEP, because I know you know all these names, but people might not know what you're talking about.
Yeah, and I mean, to your point exactly that around pregnancy prevention, while that works for cisgendered females or transmasculine individuals around pregnancy prevention, as a gay man, when I hear somebody say pregnancy, I completely leave the conversation, because that has nothing to do with me. And if I can get pregnant, then I'm hoping I'm going to win a Nobel Peace Prize for it. So, there's this idea of, very heteronormative sexual education that's out there that doesn't take into account having messages for gay, bisexual, lesbian, trans identified individuals. For lesbian identified individuals, They hear pregnancy, the same thing too. I don't need to know about this. But then we need to tailor the conversation about toy play for them. What does that look like? Sanitizing toys, cleaning toys, making sure we're not sharing toys, using latex condoms on your toys. There's so much more than just the pregnancy talk. But again, that's what people understand. They hear pregnancy and they automatically get it. All right, I need to prevent that. What about everything else?
Yeah.
So when it comes to PrEP, so I mean, PrEP's been around now for, what are we in, 2024? Ooh, I feel like it's been around for about 10 plus years.
Really?
Yeah. So PrEP is a medication that can be taken daily or injected. Now we have a long acting injectable. So PrEP oral pills can be taken daily to help prevent the possibility of HIV transmission. And why we call it PrEP, it's pre-exposure prophylaxis. So you're taking it before the exposure happens. Some folks take it daily. Some folks are doing PrEP on demand, which means that they're doing a more condensed version of the medication. When they know they're going to have an exposure, they'll take a higher concentration of the medication in a short amount of time. And then we have the long-standing injectable medication. So one of these three options are a really great way to ensure that if somebody is engaging in unprotected sexual activity with either unknown partners or if their partner's living with HIV, there's the protection of not contracting HIV. Now, granted, it's not, I take a PrEP pill today and I'm good tomorrow. No, it takes about 7 days for the medication to really be highly concentrated in the body. But that's more for, depending on the orifice in which you're having sexual contact with. So for anal play, you're looking at about 7 days for max concentration. For more vaginal play, we're actually looking at 21 days for full concentration of the medication. So it's really, providing this information for folks so they don't understand. They go to the pharmacy, they take their PrEP today. I'm going to go and be,
Superman.
I was going to say a different word, but I don't know if I can say it on Zoom. I'm going to have a really good time and I'm going to be protective. Hold on. Wait, let's take a step back. Let's remember we need to make sure we're taking it for a good amount of time to get the concentration. So, definitely in regards to it seems easy in theory for folks, but we're all adults here. We have very complex lives. And it's hard to remember to take a pill every day. It's hard to remember to take 5 pills in a short amount of time because you're going to have an exposure. So definitely, I think the injectable has opened up a world for individuals because folks can say, hey, I got my injection last week. I'm now good for 30 days with having high concentration and protection of the medication. So definitely the advancements are there. So I would definitely say to folks, if, particularly for providers, regardless of sexual behavior, because that we're going back into the days of behavior risk taking. Now we're much more into the realm of education for all, regardless of the behaviors that they're having. A heterosexual married individual can still be at risk for HIV and STIs if they're stepping outside of their partnership. So again, we don't know exactly what's going
Or
on in
the
people's
whites.
or right, exactly on either
Yeah.
side. Exactly, either side it can be. So we don't, and also, to be very honest, not everybody's fully transparent with what's going on in their homes or what's going on in the bedroom. So for us, we'd rather ask the questions. So for us, we know we did our due diligence. And again, usually what happens, something comes back positive. They come back to see us. They were like, well, I wasn't 100% honest. And that's okay. But now we can have this open dialogue to say, this is what's going on. Let's get this treated and let's figure out how to prevent this in the future.
No, Justin, what about PEP?
Oh, PEP and PEP. So PEP is post-exposure prophylaxis. And PEP we've actually been using in the medical field for decades at this point. So what was we were
It's
using
like
PEP?
Plan B.
It was Plan B, but for HIV, we like to say. So for occupational exposures, so for nurses and things like that, stuck by needles, unsure of the source patient, their HIV status, they were giving antiretrovirals for 30 days to take to avoid that. Studies were created to see if we can do this for HIV prevention for sexual behavior, and we found out that it works. So for PEP, someone has anywhere between 36 and 72 hours to take an antiretroviral to what we call stop the clock. So basically, once that medication is introduced into somebody's body within 36 to 72 hours, we're stopping HIV from infecting the body. So once that first medication's in, we are now taking the medication for about 28 to 30 days. That's going to ensure that there's no possibility of HIV getting into our body and infecting us. After those 30 days, we're doing another HIV test just to make sure the medication did its job. After that, there is no longer the possibility of HIV being transmitted. What we do with a lot of folks that are on PEP, we do have the conversation very early on about transitioning to PrEP thereafter. Because if you're going to have a one-time exposure, there's a possibility you're going to have another exposure in the future. So we rather you be protected and have the mental comfort knowing that you have this protection in your body versus not having exposure, and then the anxiety kicks in. Oh my gosh, I have 36 hours to figure this out. If it's a long holiday weekend, what does that mean? If a clinic is closed, if the ED's, inundated with things, there's so many complications that could happen that we really try to tell folks, hey, you're sexually active, that's great. Here's a medication you can use to protect yourself.
Mm-hmm. And Carlos, I know that you do a lot of work in the community. Do you feel that people out there in the community know well about PEP and PrEP and how to prevent not just HIV, but STDs in general, sexually transmissible diseases?
So I think that there is some information out there, but I definitely think that there's a lot of room for us to make sure that we provide that education. Again, I think sort of just echoing with what Justin said, because unfortunately this education is not provided, especially for young people, in schools or in community organizations. We're kind of really having to go into the community. We're kind of having to get in and connecting with people and providing this information. So I would say there's plenty of room for us to continue this education because it really is essential. And ultimately, at the end of the day, this is about prioritizing people's health. Like that's all that is this is really doing. So that information, I know that we work in collaboration with the Rockland County Pride Center and a few other organizations here in the Rockland side of things to really provide that information in a way that is going to not only be informational, but in a way that's really going to target the community. We first want to target those who might be most at risk. And then again, as Justin was saying, I think it's essential that we include sexual health in just your general health care. This should be part of it. At the end of the day, this conversation, we should have our physicians and our doctors and our nurses all properly trained and educated to incorporate this type of care, because at the end of the day, do we not just want to make sure that everyone is healthy? Do we want to not make sure that we don't have to deal with major public health crises?
Mm-hmm.
And we also do realize that, it gets harder and harder to treat, particularly bacterial infections, when stronger and stronger strains start to emerge. So let's get this education in multiple areas, whether it's community education, whether we're talking about education while someone is going for their general checkup or for their, visit with their doctor. Let's find all these different approaches to make sure that people can get that education so that they're informed and that they can take full control of their lives. And again, we shouldn't be shaming or stigmatizing pleasure. Pleasure should be part of our overall health. So let's make sure that we're doing whatever we can to provide that level of education, whether it's community-based or whether it's right there in a clinic.
And Carlos, going back to the topic of stigma and how hard sometimes it is to bring these conversations out there in the community, how hard is it to start these conversations in the schools? Because you just mentioned the schools.
So it's extremely difficult. Again, I can speak from the perspective of working with schools here in Rockland County, which again is a county that's just outside of New York City. You would generally think, if you were not fully aware of Rockland County, that this is more of a progressive part of the country. However, unfortunately, when it comes to conversations, even around HIV, there are actual permission slips and consent forms that have to be sent to students. This is something that doesn't exist in the city, in the 5 boroughs, but it certainly exists in Rockland County and all the other 50 plus counties that exist in New York State. So the reality is it's a tremendous challenge, and it is a disservice to our young people, because at the end of the day, should we not prioritize the health of all people, and especially our young people? This is really ultimately making sure that young people are informed and educated so that whatever happens, and we know that there are, I don't have children, but I've had conversations with parents that have children who are adolescents, and the fear, like we were talking about, is pregnancy. But what about sexual health? What about making sure that we equip our young people to, one, be sure that they are safe and that they have safe spaces or safer spaces, as Justin said, to be able to have these conversations, but two, that they're educated and informed so that their health is of the highest priority. We got to make sure sexual health is something that we treat on the same level as any other type of health. We kind of work through the Affordable Care Act in allowing for mental health and physical health to be sort of on the same level. Let's include sexual health into that conversation. Let's ensure that that is part of the equation. If we can destigmatize this, if we can say this is just talking about overall general health, then I think we are going to do much more for everyone, including our young people, in just addressing any future public health and individual health issues that could emerge.
Mhm. And at this point, I would like to invite our attendees, if you have any comments or any questions, or you would like to share anything related to this topic, please use the chat. I'll be happy to voice your questions and comments or concerns, anything that we wanna hear from you, basically. Please voice your opinion.
And if I may, just if I can add, so, for myself, I am an openly gay man, but I'm an openly out individual living with HIV. And for myself, both as a patient and a practitioner, I have the understanding of both sides of the coin, because I've been in clinical spaces that were not affirming to a gay man, that were not affirming to a person living with HIV. I've been to, appointments where, the minute they knew that I was a person living with HIV, it's just, I kind of saw the staff kind of do one of these, like one of those backup kind of situations. These were younger years, but, again, for myself, I've been living with HIV since I was 20. I won't say how long because I don't want to give my age away, but, in regards to the idea of, being able to walk into a space and be our authentic selves should be bare minimum these days. Anyone should be able to walk into these spaces, whether they are trans, cis, gay, straight, bisexual, black, brown, whichever. Folks should be able to walk into a space being themselves and be received with respect and dignity. At the end of the day, if we can get those two values as bare minimum, we're going to be able to really go places. But for folks like myself in the situation where we're engaged in HIV care, we're probably more in line and in tune with our medical care because of the emphasis to take care of ourselves. With primary care, this is a quick 15-minute video, a quick 15-minute visit. You're good. You need some vitamin D. Here you go. Have a good day. I'll see you in a year. Where it's for us living with HIV or folks that are, trans-identified, we're seeing providers every 3 months, every 4 months, every 6 months, some folks every 2 months, depending. So, for us, we're a little bit more engaged in our medical care than our heterosexual or cisgender counterparts. So I think that's why, as a community, we are a little bit more aware of kind of what's going on, because it's ingrained in us at a young age that we have to be safe. We have to protect ourselves. So I definitely, share that to say, regardless of someone's HIV status or, sexual orientation or what they're doing, walking into a medical space should be a safer space for all.
Mhm. And I like how you say, Justin, that you're more engaged with the medical field, but I'm also a diabetes expert and thinking, diabetes is not that different. You have to be going to the doctor every 3 months, doing blood work, taking medications, making sure, everything is okay with you. And maybe it's time, and now starting to look at the future, like HIV shouldn't seem any different than any other chronic disease that you need to take care of, but also providers need to be a specialist in learning how to help you. And if they don't know how to help you, they have the duty to refer you to a specialist that is going to be able and knowledgeable enough to help you, basically. So, what do you see being the future of HIV? I mean, we've done a lot of progress, though. Now it went to be a deadly disease or infection to a chronic disease, and now people are living many I mean, longer
Mhm.
years. They don't look sick at all. Some people you might not even know, including yourself. Right? It's amazing. But what do you think is going to be the future?
I mean, I think as of right now, we're all trying to put ourselves out of a job. We're trying to eliminate HIV, which
Of
is
course.
great. And we're definitely getting to a good point where we're seeing reduction in new infections. We're seeing folks living with HIV for longer, not seroconverting to an AIDS diagnosis, living well into their 90s, from other health complications, not HIV. So, we are getting to a good place. But, even if we cure HIV, which I'm hoping in our generation we'll see it, even if we cure HIV, there are still sexual STIs that are still going to be around that still need to be treated and taken care of. So, one of our providers, Dr. Bernardo, gave a talk not too long ago about the future of AIDS centers
Mhm.
and how they're really transforming into sexual health centers because it's more beyond HIV and AIDS now. Now it's really looking at someone's complete sexual lifestyle, taking into that account and providing prevention, education, and information for that. So even if we get to the point of curing HIV, which is great, people are still going to be having unprotected sex, which means there's still going to be syphilis, gonorrhea, chlamydia, trichomonas, BV, mycoplasma, et cetera, that folks still need care for. And there's still going to be individuals that are of trans experience that need gender affirming care. And we really kind of have to have the conversation of kind of teasing out the two. Just because someone is of trans experience does not mean that they are hypersexualized. We have a lot of folks at our wellness center, in our Rockland Center, where they're trans identified, but they're not interested in sexual health. They're not sexual, they're not sexually active. They're not interested in HIV and STI screenings. Yeah, they may get an HIV testing because we offer it, but they know it's going to be negative. So again, it's really looking beyond just the silo of HIV and AIDS and really kind of broadening our experience to say, this is no longer an HIV/AIDS epidemic. This is a sexual health epidemic. Right now, we have a shortage of penicillin used to treat syphilis cases. This is a problem. So we're telling people to be, safe, but when they are infected with syphilis, now instead of a quick shot that they can get for treatment, now they have to take pills for an extended amount of time.
Mhm.
So, we want to make sure that even though that there are these barriers to get treatment, there are ways that we can treat folks best. But I think definitely we have to have the understanding that we need to continue to look to the future, what a future is going to be like without HIV.
Mhm. Yeah, and I'm glad that you mentioned syphilis because a lot of people don't think about it, and the rates are growing, especially in Rockland County, and it's not
And
among
especially in
women,
older individuals,
older
especially in older
heterosexual
individuals.
men. So this is something I would need to pay attention to because, as you say, I mean, come on, it can affect everybody. So
Yep.
I love when you said that in the beginning, that if you're having sex, you're at risk. I think so. And I
Yep.
think that we need to be conscious about that. And it's great to have services where you can go and openly say, regardless of who you are with, what do you like, as you say, what orifice do you use or whatever, you need to have that space that you can like openly say what's happening to you and be treated, for whatever it is, HIV or something else, because we can get into bad shape if we don't do something soon, actually.
Correct. Yeah.
Mhm. Well, we only have a few minutes left, and as I said in the beginning, I wanted to start this right away because we could talk for hours here. Uh, but just to start closing up, let me see the chat. There are some comments here. Thank you for the forum. I shared with my colleagues. I appreciate Mr. Toro's vulnerability and sharing. And I have to say something about Justin. He's we're very lucky to have him because Justin is a spokesperson for HIV, LGBTQ rights. He's famous, actually. You are. Google your name. And it's such a great thing to have you here because we know how much you do for all of these topics. And then Carlos, same here. Carlos it's an amazing advocate and the best we have in Rockland. So I'm really grateful to have you guys and work with you. It's amazing. It's a learning experience every day. I learn so much from you, so it's amazing.
Thank you
Okay,
so
let's
much.
keep
And in
going before I
return,
start
and in return,
crying.
Sandra, we have to give Sandra her flowers
Yeah,
because it was her work that allowed us to open up the Wellness Center and the
absolutely.
advocacy that was done. So the fact that we have allies in places that
Yeah.
are advocating for us, it takes a village is the, is definitely the phrase we use. It takes a village to do this. And, it's for me, it's more so I didn't have the opportunity to have older gay men in my life when I was younger to learn from. So that now that I'm the older gay identified individual, making sure that, the next generation is prepared to, be advocates for themselves, to fight for themselves. There's been a lot of work done, and I am so appreciative of the generations that come before us that they had to fight for access to medication. They had to fight for access for visibility. We in this generation don't have that full battle. There are still some battles that we're fighting, but I'm hoping with every generation we're getting closer to the bare minimum of just respect and visibility, and equality for the type of care that we deserve. Because LGBT care is really no different than any other care. It's just having the understanding that LGBT folks are maybe a little bit more complex in certain areas that they do. So it's really just understanding that mental health, social supports, medical care, really looking at the whole person is really what we need to do these days.
Yeah, and I just have to say, in my defense, I'm just against any sort of discrimination. I just think that it's not, we should just not have discrimination. We should all love each other. Um, and yes, we need more allies in every single way that we can just make sure that everybody has the same good care and there is equality, and that we can help each other the best way. Carlos, what are your final thoughts?
Firstly, I have to say, I have to thank the both of you. I know that we get you, but quite honestly, the work that you both have done to create this type of care in Rockland County, again, sort of echoing what Justin said, this is something I wish I had when I was younger. I honestly, truly wish I had that. And I will tell you from just anecdotal experiences with patients that come in, especially our younger patients, but also our older patients, because we have older patients as well. It has been so just unbelievable how grateful and appreciative people are to get this type of care, and the work that you both have done to allow for this to not only just exist but flourish and grow has been a true dream of mine. So I'm going to just take this moment to be extremely grateful for the work that the both of you have done, because it really has been, I might get a little emotional. It
I
has
stop
been,
because you're making me cry.
it
The
has
three
been,
of us are going to end up crying here.
I said I was not going to do this today, it really has been incredible, and I'm just so grateful, personally, but on behalf of someone that belongs to this community that hears the feedback. It has been truly life-changing, and I know it's been life-changing for me, and from the conversations I've had with patients and seeing them come in, it's been life-changing for them too. So I love that Rockland County has this. I'm a lifelong Rocklander. So I just want to just really just, I'm grateful for this space and for this conversation. I'm grateful for the both of you. And I'm grateful for Montefiore NIAC for, creating this space. So, and of course, Montefiore Medical Center, because we could not have done this without all the support that you've all provided over there as well. So I just want to end it on just pure positivity. That's all I can do right
Yes.
now.
And to end in a positive note, a note here says, thank you, Carlos, for bringing the attention to how important it is to place sexual health at the same level of mental health and physical health. And there are a whole bunch of thank yous here. Thank you, very informative. You're both making me cry, and that's not me. That's one of our attendees also. You're also special. Thank you all. This is so beautiful. And just to close our topic before I say, next week, accessing rehab services is our topic. So if you want to learn more about rehab, join us. But to end today, I'm gonna end with a sentence from Abraham Lincoln that I think that will summarize what we've discussed. And it says the best way to predict a better future is to help create it. Right? And I'm gonna leave it there. And I'll see you next week. Justin, Carlos, my respects.
Thank you so
Thank
much
you
Always
so
for
much.
having us. Thank you,
Thank
thank you,
you.
thank you. Good. Have a good day, beautiful people.
Yes. Take care, everyone. Be well.